Hello, beautiful women out there, and welcome back to the Menopause Revolution podcast. I'm Leah Kapral, certified nutritionist, scientist, and holistic menopause coach. I'm so happy to be with you, so welcome. Welcome, Dana, to the Menopause Revolution, where we share the conversations that are not being had about menopause. I met you at a summit on menopause, and since doing the simple exercises you shared, my urgency to pee and mild leakage has disappeared. So I welcome you, and I just want to share that Dana is a physiologist. She's a pelvic floor physiologist, a specialist, and she's a graduate in skills and skilled in conservative management of prolapse, which we'll talk about further in the podcast. You are the founder of Evoke Physiotherapy, and that also offers telehealth appointments, and you're part of a clinical team at Pelviology, supporting people with pelvic health concerns through all stages of life. And you are known for making pelvic health approachable through perimenopause and menopause and beyond. So thank you for sharing yourself, and welcome to the podcast. So I was doing a little bit of reading beforehand that it's very common for adult women to experience pelvic floor concerns, especially midlife, when hormone decline begins to take place. Can you share what are some of the common conditions or symptoms you see in women midlife?
Well, as you said, a lot of this is related to the hormone decline that we see in perimenopause and menopause. So mostly estrogen declining, but also progesterone. And it can be a time for pre-existing issues to worsen, or it can be a time for its own set of new issues potentially. And some of those might include urinary incontinence. There could be urinary urgency or frequency, so going to the toilet more often and needing to go like you're really busting. There could be vaginal dryness or discomfort, more frequent urinary tract infections. There can be changes to the bowels sometimes too. That could be a little bit more constipation, or the gut slows down a little bit. And there can also be painful sex or changes to libido and intimacy. And that's all as a result of the declining estrogen and hormone levels that we see at that time.
So it's a actual tipping point, like when what I'm hearing is when hormones are changing, that pelvic floor area begins to change, right? Because of those decreasing hormones.
Yes.
And, as I shared in the introduction, I did experience a little bit of leakage and also an urgency to go to the toilet all of a sudden. And I was just like, am I drinking more water? What's going on? The exercises that you did share previously at the summit really supported me. Like I just went home and I did those, and it's totally reversed it. So I can see how, it's very common, and that women actually probably don't realize it's incremental, and then that it can be reversed, and it is an actual symptom that can that is going on for them.
Maybe. So we have declining estrogen and progesterone levels. We have direct tissue effects that we see in the vulval and vaginal areas as a result of that. So we get lower blood flow to the area. We can see the tissues can become thinner, they can become drier. The urethra doesn't close quite as well. So even if someone's only had a little bit of leakage, it can suddenly change. So it can, definitely be a tipping point. And then on top of the changes that we see in the pelvic floor, we actually have estrogen receptors all over our body, and we get changes in our musculoskeletal system as well. So, and of course, part of that is including the muscles and the ligaments and things that make up the pelvic floor as well. So they can change too. So we can see very gradual changes in muscle loss too. So, but the exercise is a huge game changer for that. So we've got grade 1 evidence that pelvic floor muscle training helps with these genitourinary symptoms of menopause.
Sounds like there's a lot there going on. So it's a great topic to share with everyone out there. What are some of the biggest gains from incorporating pelvic floor exercises? You started to introduce those just now into your exercise routine. Like it's something that we want to make routine to really strengthen that. So, can you give us an overview of some of those gains?
Yeah, I think it probably flows on from what we were previously discussing, that it absolutely can combat some of those symptoms of genitourinary syndrome of menopause. So it's directly going to influence those symptoms that women experience. And for that, we want that sort of 14, 16 weeks of regular muscle training. So we actually can see tissue changes improve, muscle strength can improve, even sexual function and orgasm can improve. And then we have wider contributions. So then our bladder function might be better and the bowels might empty better. Those sort of things can change if the muscles are functioning well. And you might be able to participate in other exercise without leaking. So if you're trying to do something at the gym for looking after your health in menopause and you've been limited by your pelvic floor, then absolutely we address the pelvic floor and it gets you back doing what you want to be able to do.
Yeah, thanks for reminding, even just things like lifting things or having a sneeze or, some of those things that we'd like to do, but we get a little bit paranoid about now. If there's some mild leakage, it starts to build up incrementally, and you can start avoiding doing things that you'd actually love to do. So it's great to hear that there is a way to get into doing what you love to do again, like with a little bit of specialist help or a little bit of strengthening down there.
Yes, sometimes it is a gradual kind of process, and some women come in and say, I don't know how I kind of ended up here, but it's probably been an issue since I had children, or it's been an issue for 10 years, or it can be ongoing for quite a while before someone hits that tipping point of now I need to change and do something. But it's really quite exciting to help women get that strength back and then get back to doing the things that they actually want to be able to do. That's our ultimate goal, right? To have a better quality of life, to be able to, dance at a wedding and not worry about leaking, to be able to do the sport that you want to do, or one day, kick a soccer ball with grandchildren. That was another client's goal recently, where that was what she wanted to really be able to do. So, yeah, love having goals to help women work through. Yeah. Oh, I could say something more that around the muscle training, that some women, it's not always just pure strength that they need. They could actually have issues around muscle tension that could be contributing to painful sex and things like that. So we're not always just about muscle strength. We're about what do they do? Can you use them properly? Can you squeeze them? Can you relax them? Do they squeeze and relax at the right time? So, to let things come out, and also to let things go in. So if we're talking about intimacy. So, yeah, having correct muscle function is not just about strength.
So also just releasing some of those muscles as well is something that you can support women with, just in terms of sexual intercourse and having less pain, which
yes, it really depends on what's going on for someone as to what our treatment target. Sure. I'd like to throw it in there. I think it's important. Some women think, I can't get my pelvic floor muscles to work, they must be weak. But sometimes they're not weak, they're actually hanging on and don't know how to relax. So,
sure. Okay. I'm sure there's a lot of stored emotions in that area that could have happened too.
Yeah, sometimes it's a bit more complicated than just the physio and muscle function, and definitely for women there can be a lot that's going on, and traumas and other experiences that might contribute.
Sure. Okay, so I'm going to just jump into the third question. So are there any common exercises that may damage or loosen the strength of the pelvic floor area? And maybe like even what you just shared around the tightening of muscles, maybe there's things that will exacerbate that tightening. So can you share about, some of the common exercises that could damage?
I think that's I don't like the word damage very much. I'll say that to start with. I think it makes us think there's something broken or wrong, but I think our bodies are pretty amazing and we can recover from a lot of things, and we can change muscles and we can change tension, we can change strength. I think also try not to label exercises too much as good or bad, because we don't all lift or do things the same way. And this has been looked at in research. Even the way that, someone picks up bags of shopping and puts them on the bench is different. So it's all about how does a woman actually activate the muscles there. So if we were holding our breath or bearing down or doing something like that, that could be harmful to the pelvic floor. Whereas it's really more of a technique thing. How do we manage the load in our whole abdomen, our breathing, our, how we brace and move? It's very individual. So are there things that will damage it? Look, probably the more damaging things are, again, I don't like the word damaging. We might switch that to what's more beneficial or harmful, perhaps, I don't know. But now I'm kind of waffling. What else was I going to say? So a lot of women want to be able to do high impact exercise. And if you've been following any of the information on menopause around, for example, Vonda Wright's book, Unbreakable, there's a lot of content on being able to do jumping and plyometric things, because it's good for our bone density and our muscles. And that could be a problem for someone who's got urinary leakage, absolutely. So there need to be some rehabilitation around, can we get those muscles stronger, or do they need some sort of a vaginal support device to help them be able to do that if that's what they really want to do. And similarly, possibly heavy weight lifting is also, again, weights are recommended in menopause. We want to keep bone density up and muscle mass strong. But the pelvic floor needs to be able to manage with those loads if that's what we want to do. So yeah, it's not that the exercises, sometimes the things that are good for the rest of our body might be challenging for the pelvic floor, and we have to find workarounds and solutions so that women can do what they would like to do.
Yeah, what I'm hearing is like a holistic plan, midlife, and really having a team of specialists to support the individual. And, even myself, I was someone who went to the gym, and I did, the stationary equipment was there. I did some floor exercises, but now I'm finding I've had to go to get a movement assessment and a functional assessment to actually start strengthening some of the other muscles that just have been weak all my life, but now it's coming critical. And what I'm hearing is, it's also pelvic floor. You need to consider bone density. There's nutrition. There's all these other parts of health that we really want to bring together for the individual.
Definitely. Yeah, I think it is very much holistic care is what we're all about. And sometimes that feels like a lot of work, though, to some women, right? Like they feel like, oh, so now I've got to, and I think there's been a lot of Instagram posts on that, like, oh, so I've got to hit this calorie goal and do this amount of exercise and do this and get my sleep and manage this. And it's a big to-do list, isn't it?
Yeah, it can become, it's something that we have to manage, basically. Our health, where I come from is that I've been blessed to have really good health up till now. And there has been things there that, I could have actually prepared earlier, but I haven't. And now it's time to really bring health as something that's really up there in my priority list, because I want to live a long life and I want to feel great as long as I can. So, it might feel like a lot of work, but yeah, it's a lot better than feeling like, not being able to get off the couch because, my hips are, really stuck and inflamed. I'd rather be able to get off the couch easily. I'd be able to have great energy, all these things, go to the toilet easily when I sneeze, don't, have to go and change my underwear, all those kind of things. It's worth going and, seeing a specialist and doing the exercise to prevent that so you can actually live a quality life. So.
Definitely, yes. And I think sometimes it's just where to start. Start where you can and start implementing some sort of changes that you can. And for some women it's a mountain and that they're ready to climb, and others it's kind of scary and they don't know where to begin. But yeah, definitely small changes and oriented to your main goals, I guess, is important.
It's not working.
Yeah. They have actually shown that our health behaviours in our 40s and 50s will be predictive of our health outcomes in 70s to 80s. And I often think of that. I think, well, these are the years to make changes if we want to have that better quality of life as we're ageing, definitely. But it's never too late. That's also important as well. It's never too late.
There can be improvements. So, Dana, I just wanted to ask around, women that do abdominal work, a lot of, flattening of the stomach. It's something that they're really conscious of. Can you share around, does that have an impact on pelvic floor? And so that's one part of the question, because I'm in my reading to prepare for this podcast, I read that prolapse is actually quite common in women. So could you share a little bit about that, those two things?
Yes, I think, core exercises, core is our whole cylinder, right? So diaphragm at the top, our pelvic floor at the bottom, our abdominal muscles at the front, and then some of the muscles through our back and our spine at the back of it. So how we manage pressure or load in that whole cylinder is what's important with that. Some women can do a lot of heavy abdominal exercises and don't have a pelvic floor issue, but if the pelvic floor is very weak, some women can do a lot of core work and find their pelvic floor is struggling, and that can cause them leaking, or they can feel sometimes that something's bulging there where it shouldn't. So I guess that's one part of the question. But there aren't, again, right or wrong exercises. It's more, how does that woman do that exercise? How does she manage that load? And they're things that we look at quite individually to just check, is that okay? And we often look at that lots of different ways. We can look at it assessing the pelvic floor muscles internally. We can look at it through ultrasound that's on the abdomen or even on the perineum on the outside. So there's ways we can look at what's going on there, and is that a problem for that person? On to the second part of your question around prolapse. I think it's a big one to mention, because around 40% of women will experience some sort of pelvic organ prolapse. So they're quite high figures, and it's something we do need to be aware of, but not scared. So it's more about how much does it bother a woman and what impact is it having on her. So the severity of prolapse and the bother don't line up. So some women really won't be bothered by very much there, and others might be really bothered, and we think, there's really not a lot going on there. So it's more about, what symptoms do you have, how much does it bother you, and does it get in the way of things you want to be able to do? Definitely, again, with the exercises and lifting and load, it does matter, because lots of extra abdominal load can mean that there could be worsening of prolapse if we haven't managed that well. So we might teach how to breathe correctly, how to activate pelvic floor correctly, and how to lift and move and do daily living tasks to manage the load in the pelvic floor. And then sometimes we also use support devices vaginally, so they're called pessaries, and they can support the prolapse on the inside. And we would look at things like how a woman's emptying bowels, and is there constipation, straining, what else could potentially worsen that. So, there's quite a lot we do in that space, and that's just all part of that conservative management for prolapse symptoms.
Okay, so I just wanted to ask, how can we test our pelvic floor strength at home, and how and where do we go for help?
Okay, well, this one's a bit more fun, I guess, isn't it? How do we test our pelvic floor? There's a few options probably for home. I often say grab a mirror and have a look to start with, but a lot of women don't like to do that or find that a little bit confronting. So these are just options, and you can choose what feels right for you. But having a mirror can be useful to see, what am I actually doing? And you can get an anatomy diagram and just see, how does everything look down there? Do I know what all the parts are? You can open the labia and look. If I try to squeeze my pelvic floor, that would be like we're closing around the vaginal opening and lifting in towards the body. Does it look like it's doing that? Or is it doing nothing, or is it moving down away? We can get a lot visually. That's great for some people. Some women won't see very much, though. It doesn't necessarily mean they're weak either. Their muscles just may not move as much. So I think that's one that I might have discussed at the Menopause Summit, was to grab a mirror and have a look. actually. But yeah, I think it's quite useful remembering that about 30% of women don't know how to activate these muscles correctly. So 1 in 3. So if you're struggling, then that's what we're here for. Another way to assess what they're doing could be just to put a hand down there and see what you can feel. So you might touch the pubic bone area, or put a hand near the vaginal opening, or even a finger inside if you're comfortable, or even around near the back passage, and just see, can I feel a muscle squeeze and relax? Or you can practice stopping a wee. So that's probably one. Have you tried that one?
Yes. I actually introduced that into my program as well, that
Yes.
that practice. And I forgot that came from you, because it's just come habitual, like, a couple of times a week, just to remember to hold a wee when I'm going to the toilet, and just to do that a few times. Am I doing it right?
Yes, well, a lot of older women will come in and say, I was told to do that after I had my babies, 30 years ago or something. And then for a long time, it was sort of moved out of trend a little, and it was thought that it could contribute to things like a urinary tract infection, and we shouldn't do it too often. But we've since then got some information to say, well, probably is not a harmful thing if we do it on the odd occasion, and if we're not prone to urinary tract infections. So if we don't have a lot of issues there, then it's probably okay as a test occasionally to do that, and just to see, can I stop it? Am I using the right muscle?
Yeah. No.
So
yeah, that was a great exercise, because it's, you can really notice what's going on down there, and really, you're either doing it or you're not, right?
yes,
So
yes,
it's a good one to do at home.
But for some people, it won't be the right thing to do for some people. So just being aware of that if you're someone who's prone to infections, or you're concerned, that may not be the best one. But the one-off test here or there is probably okay. But there are better exercises to do once we know that someone knows how to exercise and what they're doing. Then we definitely would grow that and teach them other things. So we might look at how quickly they can squeeze, and how long they can hold, and different positions their body can be in when they exercise, those types of things.
Okay, so you shared some of the tests we can do at home. So if we find that we can't stop doing a wee mid going to the toilet, or some of those other tips you shared, to see if we can hold down there and examining ourselves. Where should we go for help? Like, could you share a little bit about how do we see someone like you, and how do we communicate to our doctor, who may dismiss that we're actually having these type of symptoms? How do we communicate clearly and empower the women out there to see someone like you?
Yeah, I think, well, it's good to know, definitely, yes, pelvic floor physiotherapists, this is our jam, this is what we do. We have lots of different ways to help women learn to activate their muscles. And technically in Australia, you don't need a referral to see a private women's health physiotherapist. You can just find one and book straight in. Then you can use your private health cover, or if you don't have private cover, just pay out of pocket for your visit. If you're wanting to access a Medicare chronic disease management plan, some people would be eligible for that through their GP, and then there's a partial amount that Medicare will cover for up to 5 visits in a calendar year if you haven't used the services elsewhere. So there's a bit more to read up on that side of it, but then that can be a GP conversation. And I think the conversations with GPs can be varied depending on their knowledge in this space. But I think definitely a woman could say, I think I'd like to see a pelvic floor physiotherapist, and these are my concerns. And then they could discuss that with the GP, but they don't necessarily need that to come to us.
Okay.
So I think that's important to know. If there's any complicated history, it might be useful to have a referral, but we can see women without one as well. So, and then in clinic, we can look at the muscle activation. We've got options for assessment. We can look with ultrasound on the tummy or on the perineum and see, do the muscles squeeze and let go. We can look visually, and we can do internal examinations if that's appropriate and what a woman's wanting to do. So lots of different ways to look, and then even teach how to use the muscles. So we can use all those things, options as a teaching tool. And some people who might actually be very weak, we can use like a electrical stimulation to try to have the muscles fire up that way, so a woman can feel, oh, that's what it's like when it's working, and we can get stronger that way. So
she's got that
we
memory.
have a lot of options.
Yeah, a lot of options. Yes. So lastly, Dana, I just wanted to ask around the topic about painful sex, midlife, and also loss of libido. Do you have any tips in how to support this and what's out there as treatment options?
Yes, I think loss of libido is quite common, and it's a little bit more of a tricky element, but we'll jump on that bit first. Lots of things contribute to that. So libido will be impacted by stress, relationships, other elements, what else is going on in life, what past history is there, what could be in the picture there. So I think that one is often a little bit more complicated. There's definitely some elements that a pelvic physio can help with, but sometimes we might also need help from other professionals depending what's going on for someone. And we might even look at how's their nervous system functioning. Are they getting enough sleep? How's the stress? How they're, if you're feeling absolutely depleted, run down, terrible, then often sex isn't something that's like the front of your mind. So, yeah, it's looking at that very holistically. Then in terms of more of a tissue-based what's happening down there, we know that there's the hormonal change that contributes. So, and we have first, great, evidence for the use of vaginal estrogen to manage those symptoms. So that's probably my big thing I often want to discuss with women is, have you seen the GP about an estrogen cream? Is that suitable for you? It is quite low risk, and many women can use it, and there's even a little bit of research now which we didn't used to have in the breast cancer space, and which women possibly could use that too. So complicated and a whole nother conversation, but that we've got evidence for vaginal estrogen, and we've got grade 1 evidence for pelvic floor muscle training. So that's normalising the function of those muscles. So those two things will change the symptoms that we get down there. When there's painful sex, we need to figure out what else could be going on for that person. So is it just the menopause hormone changes, or is there something else? Making sure there's no other medical condition responsible for it. Sometimes it'll be that something's hurt once or twice and there was a tissue change, and then the muscles become protective, so they kind of go, oh, that hurt last time, I don't know about that again, and then the muscle tension can create some problems. And they're doing their job trying to protect us, but it's not always the most helpful thing in some of those situations. That we need to look at, well, how do we make those tissues more comfortable? Do we need other non-hormonal moisturisers? What else? And, lubricants we can advise on. What else can we do to make things feel more comfortable so the muscles can actually relax and so the woman can enjoy the experience of intimacy?
Thank you.
Definitely, yeah. And even changes to body image, if women are feeling different about how their body's changing and what it's going through. There's a lot of shame around this and a lot of negative messaging, I think, going on, particularly, again, I'm looking at social media, and I wonder if it's just targeting that because I'm a woman in that age bracket. But there's a lot of, oh dear, have you got all of these symptoms? This is what it could be, and very, very negative messaging there too. And I think definitely how we feel about this time in our lives and how supported we are can make a big difference to overall well-being. And then absolutely that'll influence sexual function and how we feel. And yeah, probably my big question to women is, what do you want it to be? What do you want it to look like at this point in your life? And some women even view it as a time of, freedom, of free from the burden of potentially falling pregnant and having to worry about contraception, and they feel like they can discover themselves sexually, so, or rediscover themselves. So, yeah, definitely we can change the conversation to have more positive impact and view this time in our lives very differently and with the right treatment to manage the bothersome symptoms we can experience, we can definitely make things a lot better.
Yeah, agree. It's a good turning point to assess many things. And doing that in relationship with your partner as well is a new conversation that can be had. So I just wanted to thank you so much for sharing yourself today. And I just fell in love with you at the summit. You were just so practical. You actually opened up the conversation for me. Like, I was experiencing these symptoms, but I didn't actually see that they were related to perimenopause that I'm going through right now. And I just want to, from the bottom of my heart, you really, those little things that you did, it
Sometimes
made a big difference.
You don't know who you've reached and how, but you hope that someone's receiving a message in a positive way. And we need to have more real conversations like this, because there are a lot of women who are suffering silently and who don't know where to go and who to speak to safely and comfortably. So definitely was thanks. It's been a pleasure to speak with you today.
Thank you. Thanks for joining me on the Menopause Revolution podcast. Remember, you don't have to do this alone. If you're ready to discover what your body's really saying, download the free Midlife Symptom checklist on my website by going to www.themenopauserevolution.com.au or see the show notes below.